Okay. Yes, good afternoon. That's how I earn a living, working for the Centre on Global Health Security, but in my spare time I'm chair of the Medicines Patent Pool, which I'm going to talk about this afternoon. So, for those who don't know what the Medicines Patent Pool is, it is an organisation created by Unitaid as a mechanism by which originator companies of antiretroviral drugs can put their patents in a pool from which generic companies can then sub-license them without going to each individual originator company. So it's kind of one-stop shop to license patents in a particular geographic area, which is essentially developing countries, but that's an issue I'll talk about later. So the background to the setting up of the pool is essentially what happened with the antiretroviral drugs price of between 2000 and 2013. This is a graph from June 07 to June 13, which shows that price of first-line regimen has essentially gone down by 2/3 since 2007. If you started that graph in 2000 here, there, then it would be right up here at $10,000 or thereabouts. So that demonstrates, even if you ignore the first 7 years when the price went down by 95% or more, we've had a threefold reduction since in the last 6 years. And the same is very much true for second-line regimens. So the prices are higher, about at least twice as high, but we've had the same threefold reduction since 2006, and much more since 2000. So the result of that, one result is that we've been able to treat what is now 9-point-something million people annually with ARVs. Now that's not anything to do with the patent pool, but it is a function of a number of circumstances, one of which was the availability of generic medicines from India, because India did not have to apply TRIPS until 2005. So between 2000 and 2005, India was able to produce, several different Indian companies produced a lot of antiretrovirals at prices, and this allowed competition. And then the other significant factor is, of course, there was a massive influx of funding from the Global Fund, established in 2000, and from PEPFAR, the American bilateral agency. So we had several $1 million a year flowing into treatment for antiretrovirals, something which hadn't been the case before. So that accounts for this large rise in treatment. Now, we will have, as a result of new guidelines introduced by WHO this year, the recommendation was that there's earlier treatment. You begin treatment earlier in the course of the disease. As a result of that, it's estimated we will now should be treating, if you follow the guidelines, not about 16 million on the old guidelines, but about 25.9 under the new. So there's a much increased need for treatment. Now, the other aspect that is different from before 2005 is that we now have a patent regime in India, along with most other developing countries. And so we have a whole lot of patents of new, and there will be further forthcoming antiretrovirals which did not exist before 2005. So you can see here The top half is drugs that are more or less out of patent now, and the bottom half is newer drugs that could be in patent until after 2025. So these are the bottom half is what the patent pool is interested in, and the rationale for patent pool is to try and recreate that competitive environment for antiretrovirals, which resulted in those rapid price decreases which you saw in the earlier graph. So the objective of the patent pool is to accelerate the availability of generic versions of new ARVs in developing countries, to enable the development of fixed dose combinations where patents are held by different companies, and to enable the development of adapted formulations for children or for specific developing country needs, e.g. heat stability. So apart from promoting competition, the aim is that any company can put together different combinations of drugs which are patented by different companies, something that is not so easy to do without the pool. So we've been in existence for about 3 years. We have licenses covering the ARVs recommended by WHO for the preferred first-line regimen for adults and for children. At least 20 developing countries are already benefiting from access to more affordable first-line regimens. 6 ARV manufacturers, generic manufacturers, have licensed ARVs from the MPP and are working on the development and registration of new antiretrovirals. The MPP assists technology transfer to generic manufacturers in conjunction with the originator. And it also is transparent in publishing full text of each license. And another sideline is to create a patent database which is used by purchasing agencies to establish where they are able to sell products without any patent injuries. So the MPP is a new institution, 3 years old. Its success depends on persuading companies it's in their interest to join the pool, rather than adopt alternative strategies. So the companies need to consider what is the benefit to them of joining and assess possible costs. So in the negotiations, there are probably about 9 companies principally we're interested in, and we have 2 major licenses so far. We have 5 companies still in negotiation with the pool, where we will hope eventually to have an agreement. So there are a lot of issues about what the licensing agreements should contain. The principal one is about the geographical scope. So the pool, in principle, would like to cover every single developing country where there is an HIV/AIDS problem. For companies, they find it difficult to agree on a number of countries who have an HIV-affected population, but where they also see scope for their commercial advancement. So these are the emerging economies, essentially. India, China, Thailand, other countries like that. So some of the agreements, generally speaking, cover at least 80% of those living with HIV/AIDS. So it's a difference between about 85% and 100%. But that 15% is quite difficult to convince companies it's in their interest to sign up. And also companies have, in the last few years, done a lot more voluntary licensing on their own account. So there is some difficulty in persuading them it's better for them to put it in a pool where they lose some control rather than keeping control and making individual deals with particular companies. So one issue is to persuade the companies it's in their interest to join the pool. The other is there are some on the civil society front who distrust what the pool is doing because essentially it's collaborating with a system which they think is not, of which they disapprove, i.e. the current intellectual property system. So it's difficult to square this circle. Transparency can go so far, but there's a limit to how much you can disclose during the course of negotiation with companies. Otherwise, your hands are tied behind your back. So this is one difficult issue: is how to both get the trust of the companies and not to disappoint some of the more not sure what the word is, more activist of our civil society colleagues.
That's 10 minutes, John.
Yeah, okay. So, as I say, we have 5 companies in active negotiations with the pool, and we expect more deals this year. And that's it.
Thank you very much.